Why is dense breast tissue a breast cancer risk factor? Imagine your breast tissue as a mix of different types of tissue. Some parts are fatty, soft, and easy to see on a mammogram. Others are fibroglandular, which are denser and more fibrous. Women with more of this fibroglandular tissue are said to have dense breasts. Research shows that women with dense breasts are about 1.7 to 1.8 times more likely to develop breast cancer than women with less dense, fattier breasts. This increased risk is separate from the difficulty dense tissue creates when trying to spot cancer on a mammogram. Breast density depends on how much glandular and connective tissue is in the breast compared to fat. Dense breasts have more of these fibroglandular tissues and less fat. This is important because these tissues contain more cells that could potentially turn into cancer. While scientists are still studying the exact biological reasons, having more cells means there are more opportunities for abnormal growths to develop into cancer. Another reason dense breast tissue is a risk factor is that it makes detection harder. On a mammogram, dense tissue appears white, just like tumors. This similarity can hide tumors, making them harder to find early. As a result, cancers might be diagnosed later than they would be in women with less dense tissue, which can affect treatment options and outcomes. Several factors influence breast density. Younger women tend to have denser breasts, and women who use hormone therapy during menopause often have increased density. Women with dense breasts may have a risk level similar to having a close relative with breast cancer or a history of benign breast biopsies. However, having dense breasts alone does not mean a woman will definitely develop breast cancer. It is just one piece of the overall risk puzzle. Because dense tissue can hide tumors and slightly increase risk, some women may benefit from additional screening tests like ultrasound or magnetic resonance imaging. But current guidelines do not recommend these tests for everyone, only for women with higher risk factors or very dense breasts. It's important for women to talk with their healthcare providers about their individual risk and screening options. In summary, dense breast tissue is a risk factor because it contains more cells that could turn into cancer and makes it harder to detect tumors early on mammograms. While it does increase the chance of developing breast cancer, it is just one of many factors. Women with dense breasts should discuss personalized screening strategies with their doctors to ensure they are getting the best care based on their unique situation. Always remember, staying informed and working with healthcare professionals is the best way to manage breast health.